Welcome back. The telltale sign of a breast lift is the so-called anchor scar that commonly goes with it. Women travel from around the world to see our next guest because he's found a way to boost the breast without that scar, and that boosted the spirits of the patient you're about to meet. Here to tell us about the procedure, please welcome plastic surgeon and developer of the Horndeski Method, Dr. Gary Horndeski, along with his patient, Angela Reynolds. Good morning. How are you? Okay, so the breast lift, which is different than breast augmentation, but you could have both procedures at the same time.
Right. Most women, if they're happy with the size of the breast, they don't need an implant. And frequently people come to me, they just want the breast back the way it used to be.
Yeah. The
most frequent thing I hear is, doctor, I've had pregnancies, and I just want my breasts back the way they used to be.
Yeah.
And that's all they want. They were happy with that.
Yeah, and then, of course, the lift is if, gravity has taken its toll.
Sure.
And that's what you were looking at, Angela. But in your case, you lost, which, congratulations, 160 pounds.
Thank you.
Literally, you lost the equivalent of me, because I'm 160 pounds. TV makes you look bigger, so don't sit there and go, she ain't 160, she's 200. But anyway, but yeah, you lost the equivalent of my whole body. But when you do that, there are things that kind of go south, and that was one of them.
Yes, absolutely. I knew that I needed the help of a plastic surgeon, and so I went to somebody that was recommended to me, and I went home crying after he told me that it would take 2 surgeries and implants and to receive the results that I really wanted.
Yeah, and it wasn't necessarily the 2 surgeries and implants that bugged you so much. It was the scar that would be left behind.
It was the scarring that was left behind, that's correct.
And then you did your homework.
I did. I went home and Googled and asked for a scarless breast procedure, and Dr. Horndeski's name came up, and I did my research and reading the results on realself.com, and I went to his website, and the rest is history, really.
It's interesting because a lot of us have been told there is no scarless breast lift.
That's true. Everybody says that except me.
Yeah, of course, yeah. So tell us how the Horndeski method is different.
Sure. The Horndeski method is totally different. We never use a vertical scar. We never require implants. And the weight of the breast is transferred from the skin to the underlying muscle, so it provides active lift to the breast. Now, the advantage of this in women who need reductions is immediate relief of pain, because the skin is not holding up the breast, the muscle is.
Right, right. Okay, so we're looking at some video right here of just things that are done. Okay, so what are we looking at right here?
That's the Horndeski method with a transverse incision around for the areola, and then the breast, top part of the breast is used for the external cover. The bottom half of the breast is used to make an internal bra, basically, and the entire breast is elevated. So it's not just lifting the nipple or areola, it's lifting the entire breast mound, and that's what's crucial to get the young, perky breast that women want.
Yeah, yeah, and then there you're not seeing that telltale anchor scar, which, if you say it before, it looks just like an anchor down the middle and then right underneath there.
Sure, it looks like an anchor scar. It can't be hidden, it doesn't fade, and oftentimes it will widen and thicken.
Yeah.
And it's particularly unacceptable to women. Many women have waited decades for something new to come along, and I've seen people who have waited 30, 40 years and found me.
Yeah, necessity is the mother of invention, as we say. So you knew that as a plastic surgeon right off, saying this is why women will hold off on getting it, which is, like you said, you left crying.
Yes.
And you were thinking, well, I'm just not going to be able to get this done.
Absolutely. And once I found and saw all the results and the pictures, it was amazing.
Yeah.
I knew that Dr. Horndeski was for me.
The other thing that you really appreciated was when you called.
Yes.
Immediately.
They called me within the hour. Dr. Horndeski himself called me within the hour, and I was able to ask all the questions that I had, and then I scheduled my appointment and was seen almost immediately with that appointment.
Especially when we put our breast in your hands. We need,
Absolutely.
we need someone who gives good customer service, who's listening to the patient.
Yes.
And that's what that consultation is all about as well.
Right.
When do we know when we need a actual lift versus maybe a full implant?
Okay, if you want an implant, it's because your breast is not big enough in a bra. If you're happy with your size in a bra, then you don't need an implant. Now, when you take off the bra, if your breast droops, you don't like it.
I've heard that if you can hold a pencil underneath or a book.
That's extreme.
Okay.
The ideal position for the breast is to begin at a line between the armpits, basically. And the areola nipple complex should lie halfway between the shoulder and elbow. And that's the ideal position. So our goal is always to achieve that or higher. That's the best technique.
Yeah. Well, it's not done anywhere else in the world. This is your method. Women have come from 6 continents and 24 states to get this custom procedure here. And so we know that you love it, but I think we might need to just go ahead and seal the deal right now by getting someone else's opinion, one other person's opinion, and that happens to be your husband, Gary. Hi, Gary.
Good morning. How are you?
Good. You know, a lot of us as women, you know, you love us for who we are, and our breasts don't really define us. But did you see a change in her when she lost that weight and then got that lift that she wanted?
Oh, I saw a definite change in her attitude and the way she bought clothes and the way she just went around in her life. She's come a long way. She's got the heart of a lion, and she even inspires me sometimes to be a better guy. You know, and that's what your wife should do.
Wow. So you have a whole new life now. Losing
do.
that 160 pounds, that
I
new
do.
body, and
I have
another
a whole
chance
new
at life.
Absolutely.
Well,
I'm
thank
very
you very
thankful.
much.
Thank you.
And congratulations to you.
Thank you.
Thank you very much. I know a lot of women just went, what, scarless? To schedule your appointment with Dr. Horndeski or for more on his services, you can call 281-565-8099, 281-565-8099, or log on to horndeski.com. Move over to New York, Italy, and France. We don't mean to sound catty, but another city is now taking over the catwalk. Our next guest is part of the fashion explosion here in Houston. We'll check out David Peck's fall collection next.